That's right. We're talking about something that is a step in the right direction here, but there's still a lot of work done. Not all telehealth patients will be covered in Iowa, and I'll explain that in just a couple of minutes. But we are talking about commercial health care. The other, of course, is Medicaid, and so Medicaid will pay the same for an in-person appointment as it would telehealth, but commercial health insurance does not. And healthcare providers want to see the same amount of money siphoned to move telehealth forward.
North Liberty is rapidly growing. It's not a place where you would expect someone lacking access to life-saving tools. This is Ellen Gorman. She lives with major depressive disorder and anxiety.
And I used to be very social. I used to be out with tons of friends, but my illness kind of got in the way.
Gorman is in her 40s. She started having symptoms in her early 20s. She says her last hope was to start therapy.
Every time when I needed it the most, like I would rack up bills because I would get sick and I wouldn't make it to the appointments.
Gorman says her drive to her therapist is an hour away. That became overwhelming. Then the COVID-19 pandemic hit. She says telehealth is the one good thing to happen to her in years.
How does telehealth allow you to be more consistent with your visits?
If I can't get out of bed, all I have to do is sit up in bed, turn my computer on, and my therapist doesn't care if I'm in my pajamas.
But now that service could go away. Legislation that has passed both Iowa chambers takes away funding to healthcare professionals like therapists who have adapted to the pandemic with online appointments.
How does that make you feel?
I become fearful that I'll get sick again.
Therapist Samantha Carroll says there are many people in Ellen's situation. She says she moved her patients to telehealth. The results, patients make appointments more consistently, and that means lives saved.
I can speak specifically for one person that I coached him through some very frightening times when he was actively suicidal. And I know that if we hadn't had telehealth, we would not have been meeting.
I don't know if they're just looking at dollars and cents instead of people. I'm not sure, but it makes me very frustrated.
So what's the cause of this divide on telehealth in Iowa? Senator Liz Mathis says insurance companies are to blame, who argue reducing telehealth funding will keep costs low for policyholders.
We want more people to use telehealth because I feel as a legislator, it's less expensive in the long run, and it gets to that issue of access.
If you could speak to one of the lawmakers trying to take away this funding, what would you say to them?
That's ridiculous, right? So, I mean, as a patient, though, I'm getting better for myself care because it's consistent.